Riley. I'm Justin, your physical therapist.
Nice to meet you.
Nice to meet you. Go ahead and take a seat. So what brings you into physical therapy today?
My right knee's been bothering me. I get a lot of popping and clicking. I just think I need to strengthen it a little bit.
Okay. When did this problem begin?
Well, actually, it began way back in high school, which was just a few years ago. But then I played basketball for a number of years, and it just got worse and worse.
Can you describe that? What do you mean by worse?
Well, it got to the point where I started, when I would play, after I played basketball, the knee would swell up on me. It'd be painful. And obviously, I'd lose range of motion from the swelling.
Is there a time of the day that it hurts more than others?
A lot of times I'm laying in bed at night going to sleep and it aches.
Does it wake you up sometimes?
Yes.
How would you describe that pain? The dull pain, the sharp pain?
Mostly a dull pain. From time to time when I'm walking, it'll be a sharp pain, but like in bed and then when it wakes me up, it's a dull, aching throb.
Okay. And at its most severe on a scale of 0 to 10, 0 is no pain at all, 10 is got to take you to the emergency room.
Probably a 5 or a 6.
5 or 6?
When it's at its worst.
When it's at its worst. And then is there a constant pain throughout the day, maybe like a 2 or 3?
If I haven't played on it or done a lot of walking and that, no.
Okay. And have you had surgery on this knee?
I did back in high school.
Mm-hmm. Okay.
They torn the cartilage.
All right, now I'm just going to go through a couple questions here related to your medical history and some of your social history. Do you live alone?
No, I'm married.
Married. Do you live in a private residence?
It's a condo.
A condo? Okay. Any stairs in this condo?
We're on the second floor and I use the stairs.
I use the stairs getting up here. Okay. How would you rate your general health status from?
I think it's good.
Yeah?
Yes.
Okay, do you smoke?
No.
Have you ever smoked in the past?
No.
Do you drink alcohol?
Occasionally.
How many days per week do you drink? Beer, wine?
I probably have a beer 4 days a week.
And do you exercise regularly?
Yes.
Okay. How often?
Probably 3 or 4 times a week, elliptical.
Elliptical? For how long?
20 minutes.
20 minutes, 3 to 4
Per
times.
episode. Yeah.
3 or 4
And then
times.
we walk. My wife and I walk quite a bit. Then I play around with grandchildren, play a little basketball.
Okay. Just going to get a little bit of your family history here. Do you have any history in the family of heart disease?
No.
Hypertension?
My mother.
Stroke?
My father had a stroke, but it was later in life with some other complications.
Diabetes?
My brother.
Cancer?
My father had colon cancer. My mother had skin cancer when she was young.
Okay. Any psychological?
No.
Arthritis?
My mother.
Osteoporosis?
No.
Okay. Are you working?
Yes.
Full-time?
Sort of. Work out of the house.
Work out of the house? Okay. Now this is some of your medical history. Have you ever had arthritis?
In that knee. Arthritis in that knee.
Broken bones, fractures?
Collarbone. That's it for broken bones.
Osteoporosis?
No.
Blood disorders?
No.
Circulation, vascular problems?
No.
Heart problems?
No.
High blood pressure?
No.
Lung problems?
No.
Stroke?
No.
Diabetes?
No.
Low blood sugar?
No.
Any head injuries?
No.
Multiple sclerosis?
No.
Muscular dystrophy?
No.
Parkinson's disease?
No.
Any history of seizures, epilepsy?
No.
Any allergies?
Penicillin.
So, developmental or growth problems?
No.
Any thyroid problems?
Got a little thyroid Doctor's just putting me on some medication now,
Okay.
underactive.
Any history of cancer?
No,
Infectious disease, tuberculosis, hepatitis?
no,
Kidney problems?
no,
Ulcers, stomach problems?
nope,
Skin diseases?
nope,
Depression?
nope,
Uh, So within the past year, have you had any of the following symptoms? Chest pain,
no,
heart palpitations,
no,
cough,
no,
hoarseness,
no,
shortness of breath,
no,
dizziness or blackouts,
no,
coordination problems,
no,
loss of balance,
no.
but joint pain or swelling
In that right
in the
knee,
knee, and then pain at night,
yes.
difficulty sleeping,
Only occasionally with that knee pain.
loss of appetite,
No,
nausea or vomiting,
no,
difficulty swallowing,
no,
bowel problems,
no,
weight loss, weight gain,
no,
any headaches,
no,
hearing problems, visual problems.
no,
Have you ever been diagnosed with prostate disease?
no.
Okay. Any current medications that you're taking?
I take Lipitor
Lipitor.
and now Zinthroid. Doctor started me on Zinthroid for the thyroid.
Do you have a history of high cholesterol?
Yes.
Do you take any Advil, Aleve,
You know, I Advil from time to time for the knee.
antacids,
No,
any decongestants,
no.
any herbal supplements?
I take omega-3 and niacin.
And the medications that you're taking for the knee, you're taking Advil?
Just the Advil, yeah, as needed.
Okay. Within the past year, have you had any of these following tests? Angiogram,
No,
arthroscopy,
no,
biopsy,
no,
blood tests,
no,
bone scan,
no,
CT scan,
no.
a ultrasound, Doppler ultrasound
For thyroid,
for the thyroid, EKG,
no,
echocardiogram,
no,
an MRI,
no,
myelogram,
no,
pap smear.
no.
Okay. Do you have any other concerns or issues?
No, just like to, strengthen that knee.
Any goals that would be a goal to strengthen the knee?
Strengthen it, and hopefully that would help alleviate some of the pain when I play on it.
So strengthen the knee and reduce